in my country, we totally ignored the concept of scientific epidemiology to define who was at risk, how to establish the best public health response. We put doctors in jail. Well, no, we didn't actually, but we actually had doctors theoretically could be jailed.
Internal exile, anyway.
Done all their working lives by using off-label medications, which looked as though they were very effective. And so they were banned. And we waited for Godot. We waited for this incredible vaccine that actually took a year, when with the previous flu pandemics, using good old ground-up vaccines which work and are safe, took 6 months to make. And so, you know, when I wrote that first article for Quadrant, and I do love Quadrant, I'm giving Quadrant a big plug, because they have a sense of honesty and integrity that you do not see in the legacy press, or do you see in the legacy medical press, which we all know about. And so the reason I've written 10 articles for Quadrant is that they're kind enough to humour me by publishing them. And
no, they're not kind enough, Robert. They are objective enough.
Well, they're good. They're good.
They are kind as well, but they are primarily objective.
Okay. And so I ended up getting very frustrated because I couldn't use the treatment I needed to. I couldn't have honest discussions with patients because I would probably be, deregistered. And it was, the whole world had sort of turned around 180 degrees. So that's more or less the background, that a narrative for which there was no evidence replaced science for which there were 100 years of evidence.
So Australia wasn't caught on the hop. It wasn't as if someone woke up one morning and said, ooh, a pandemic. Oh, I didn't expect that. This had been prepared for 100 years. And then when it happens, you just get your piece of paper, you rip it up and chuck it away and replace it with some bizarre narrative. But what about you? What about you personally? Sorry, Robert.
Well, we trained for a pandemic. We have a pandemic day, where we would look at how we'd integrate the health services. We knew that a pandemic was coming because that's the reality. We just expected it to be transmitted by birds. I'll give you a small anecdote. A lot of money was put into developing this plan, and the Australian government, we took it extremely seriously. And 10 years ago, I ran a department in Newcastle, a medical school at Newcastle, both the hospital and the university. And there was one of my colleagues in my department got a grant. You're not going to believe this. He got a grant to buy a boat, buy a gun, and sit in the Hunter River just north of Sydney and shoot birds, so that we could have an early warning system if any of these birds were bringing some aberrant flu virus into Australia.
Well, we'll ignore the animal welfare parts of that, but it just shows that there was good anticipation.
Oh yeah, I mean, I joke, but the reality is we took this very, very seriously.
Yeah, absolutely, and you personally were in a good position. I mean, you've been a doctor all your life. You're a professor of immunology. You're a consultant physician. You've done research degrees. You've done a Doctor of Philosophy degree. You've got I always get this wrong. The medal's called, is it the Australia Medal you've been awarded?
No, it's the Order of Australia.
Order of Australia. My apologies, and such disrespect to every Australian. No disrespect intended whatsoever. Order of Australia. I must learn that. I'm going to write that down. Order of Australia.
Break out of independence from our British rule.
Absolutely. Yeah. Talking of honours, I've been given none by my government, but that's probably not surprising.
It's in the past.
Yeah, I'm sure it'll arrive in the morning. Yeah, and you've also got a degree. Maybe not this Parliament. What's this Doctor of Science? Not many people seem to have a Doctor of Science, Robert. What is that?
That is. It means a lot to me, because to me personally, not because of anything public about it. It basically, in a sense, gave me a sense that what I'd done over a long period of time had some value. It was by thesis, putting together my work over 30 or 40 years on how the body responds to inhaled viruses, how you develop the appropriate immune response, and what you can do about it, maybe to make it a better outcome. And my university, they told me that it was the first they'd awarded. It's the highest of the by thesis science degrees after the PhD.
So it's almost like a lifetime achievement award, really, isn't it?
Well, for me, it probably was. Yes, it was.
And during your career, you've led research teams, published well over 300 primary source publications. You're in the right place to be able to look at this objectively. Is the key thing.
Yeah, I think the only point about that is that, and many people can say that about their own area. I'm simply saying that what I'd done professionally put me in as good a place as anyone to be able to make reasonably evidence-based comment on what was happening in that pandemic at a clinical and a science level.
So were you seconded onto some government team of experts, given that you've got this high level of expertise? Did they say, oh, excellent, we've got Professor Clancy, let's get him in, let's get him involved with the decision making. Let's listen to every word he says and write it down and make notes and try and operationalise that in public health strategies. Is that what happened?
It used to happen like that, John.
It did, yeah.
It used to happen. But I guess I'm probably seen as a seriously old person now, and I'm obviously retired from the university. I still practice medicine and I still research, but I'm sort of out of that mainstream of academia.
Well, let's just say you weren't welcome with.
The point I should make is that I actually was one of a small group that started clinical immunology in Australia. And we have an organisation, a very good organisation called ASCIA, which we also began. I went to ASCIA, my professional organisation, because I found that the people who knew most about a lot of this were the immunologists, and yet we were never, ever involved in the decision-making process. Not just me personally, but...
No, the science of immunology was not properly involved.
The science of clinical immunology... Yeah. If you worked in mice, it was a different matter. But if you worked in humans, you hung out to dry touch.
Yeah, quite incredible. Now, one of the things I really liked about this paper, Robert, is you were saying I hadn't heard before. When confusion abounds, try some history. Great expression. Yeah. And the examples you give were... plague, tuberculosis, childhood infection, and influenza. I mean, maybe just unpack those briefly in order. But plague, first of all. Surely this is back in the Middle Ages plague, isn't it?
No, plague, what many of your viewers would know as the Black Death, has come in more recent times, going back to the Justinian Roman times, in three big waves. And this particular bacteria has come through from the east, from along the Silk Road initially, and basically was a precipitant for the end of the Roman Empire. The second one was 1347, was the Black Death, which came from the cities around the Crimea. And the third one, which was the late 19th century, actually came out of Yunnan in China, where some would believe that the COVID mutant came from. And that affected the New World for the first time. And, of course, Australia was part of the New World. Sure. And at the time, everyone thought that the Black Death was what we call a plague infection, that if you had the Black Death, you had this plague, you would give it to the next person. And for a particular uncommon variant of it, that is true. But most of it came from the rat and transmitted by a flea. Now, everyone watching this knows that. But they didn't know it in 1900 when this third pandemic came. And Australia's first major contribution in medicine, in my view, certainly one of the first, was to show clearly that the flea was the transmitting influence, and that what was happening elsewhere in the world was isolating individuals, and we started doing that too, you don't isolate the individual, you isolate the rat. Now, it's a rather permanent thing to isolate the rat, but it's a nice way of putting it. And so this concept, and this was all done by an amazing quantitative epidemiology, by going out and taking rats and showing that you only got splurges of the plague when the rats got sick. So when the rats got sick, the fleas left the sinking ship and hopped onto humans. And so an amazing guy called Thompson, who was the head of health at the time in 1900 in Sydney, went out and was paying, I don't know, 70, 80 cents or pence in those days for every rat. And so kids were collecting rats and putting them in sacks and travelling in the trams. Oh, it was extraordinary. And he found that once you started seeing positive cultures of the organism in the rat, then you knew the human episode was about to start. And so he could actually identify when you were going to start getting a flare-up of the plague. And by using that quantitative epidemiology, he redesigned the approach. And suddenly we went from, I think it was an 85% reduction in both the economics, the cost of the plague, and the cost to individuals in terms of numbers getting it and the number of deaths, all within 1 year. And so this established the strength of epidemiology in Australia. And when the 1918-19 pandemic for flu came, that initiated the development of specific research institutes, mainly the Hall Institute. Macfarlane Burnett was recruited, and he was basically the baseline for developing everything to do with influenza over the next 20 to 30 years. And so there's this sequential sort of stimulus of science, the communication with public health, and all of this became embodied in a plan. And this plan was presented, great plan, when COVID arrived. So I think the point I was making there, John, was that there was this long history of learning, which I don't think we've done a lot of learning with COVID, sadly.
Indeed. Amazing that's as late as 1900. I mean, the particular bacterium that causes plague, the Yersinia pestis, I mean, I'm guessing that was probably only identified about 20 years before, the Louis Pasteur period.
That's true. Yersin was a Frenchman who went off to Vietnam. And of course, you know, at that time, I mean, it was so exciting working in microbiology, and there was Robert Koch in Berlin and Louis Pasteur in Paris. They hated each other because at the time of the Franco-Prussian War, you know.
Yeah, of course.
But they were competitors, hateful competitors. And every time a cholera or plague arrived, and they would send their boys out, you know, to see if they could be the first to find whatever bacteria was causing that disease. Because you know, this was the new science. And vaccines, of course, followed very quickly.
And they didn't suffer from curiosity deficit disorder, and they weren't dictated to by a particular narrative and ordered how to think by the elites. And I had no idea that Yersin was the name of a person before. That's why the fascinating details I get from these talk, Roberts, is just...
The Pasteur Institute still exists in Vietnam. And and we had a Pasteur Institute in Sydney. Because we had a huge problem with our sheep. Remember, you know, we're basically a country built on wool, and some of the sheep properties were being wiped out by disease, and it happened to be the same disease that Pasteur had developed a vaccine for back in Paris, and so he sent his men. Anthrax, yes.
Anthrax, yeah. Wow.
And they called it the Cumberland disease. Because it was found on the Cumberland Plain, which is where Sydney is, and and Pasteur, of course, sent his nephew out to Sydney to make money to kill the rabbits with a bug that he had that was very fatal for rabbits, because the rabbits were destroying our pastures and
The myxomatosis.
industry. Yeah, well, this was long before myxomatosis.
Oh, before that.
There was a multi-million-dollar award, so Pasteur wanted the money to build his Pasteur Institute. So he sent his nephew out at the same time as we were getting this problem with the sheep. And of course, the nephew knew about anthrax. Pasteur had set up an anthrax immunisation clinic in Paris. And he did this, what was a biblical sort of experiment by immunising the sheep. And so he set up a factory for making anthrax vaccines in the Hawkesbury River, just north of Sydney. Made the money out of anthrax, not the rabbits, because the chicken industry were very concerned about this guy Pasteur coming out with a bug that was going to kill rabbits, because it happened to be the same bug that caused cholera in chickens and would wipe out the chicken industry in Australia. And I won't take too much of your time, John.
I love this kind of stuff. I just love it.
Pasteur was told, he was on a boat. We were a bit short of planes in those days, and so he was on a boat that was coming to Australia. And he was told that he was going to be held up in Melbourne, because they came around the bottom of Australia, and held up by all the chicken industry, and they were going to destroy his bugs. And so, when he got to Sydney, so he got off the boat in Melbourne and got the train up to Sydney. So
with his bugs in his suitcase.
That's correct.
Yeah, I love that.
Then he went on, and there's some wonderful stories which include Sarah Bernhardt, and which we won't go into.
But there's so much that we can learn from the history of science, and not only that. I live in Cumberland as well now. It must have been named after that place near Sydney. Because
I think they had you in mind, John. They definitely had you in mind.
For a while we'd lived in Cumbria, but now they've taken it back to the ancient name of Cumberland. So I now live in Cumberland again. Good to see old names coming back, albeit separated by 12,000 miles from Cumberland. But there you go. Good. Just briefly, Robert, if you don't mind, just say a little bit about what we could learn from tuberculosis, because I mean, tuberculosis, people don't realise how massive tuberculosis currently is. I mean, I can't remember the figure, but it's probably 10-15% of the world's population is still infected, maybe even more with tuberculosis. Absolutely huge issue. But looking at it historically, what could we learn that wasn't operationalized in the recent debacle, pandemic?
Well, the reason I mentioned tuberculosis is that I was trying to sort of build up a story that underpinned the three planks that allow us to address infection threats. And the first is public health, the second is vaccines, and the third are antibiotics or antivirals.
Yeah.
And the point I wanted to make was that I wanted to make 2 points. The first was that these planks are like a floor. They work together. If you don't have a plank, you've got a hole in your floor.
Yeah.
And it's the integration of these planks that we have to address any form of infection threat. And the second point I wanted to make was that the grandfather of these three planks, the biggest plank, right in the middle of the room, is public health. And I took tuberculosis as an example. I mentioned that the best way to look at health of a community is to look at the longevity of that community. I was just looking before we came on air at the American figures for some reason, and America's very concerned because it's dropped 4 or 5 years below in longevity from its cousins, England, Australia, etc. I think that's and I went back and looked, and the average person, the lifespan back 150 years ago, before all the Pasteur and Koch contributions, was 34. Not
just incredible, isn't it?
It's incredible. 34. That's in England too. And so the lifespan in Australia in the 1850s and 60s was 34. Now the lifespan has changed to 83. And so we've more than doubled lifespan. Now the question is why? And when you look at the reasons, you look at these three planks. And the point I wanted to make with tuberculosis is that, remember, tuberculosis was killing 40%. It was the biggest cause of death in Australia.
Oh, if you got it, it was pretty well a death sentence for a lot
and
of
you had a
people.
50% chance of dying if you got tuberculosis. In fact, we built our country on tuberculosis in a good way, in that so many terrific English people got tuberculosis, came to Australia for the air. I talked about Ashburton Thompson as doing this amazing epidemiology in 1900. He was actually was trained as an obstetrician and then got involved and interested in public health in Europe, and then came to Australia because he had TB and he thought he'd have a healthier outcome.
Yeah.
The person who began our wheat industry came here because he had TB. He was a cousin of doesn't matter. But there were so many of the great people who contributed. Alan Cunningham, who began basically scientific botany in Australia. And remember, botany was the big science in the 19th century. He actually ended up dying in the Botanic Gardens. I mean, what a death, of Sydney from tuberculosis.
So you showed me around, beautiful place.
Massive problem. And what changed the outcome of tuberculosis was not antibiotics. Antibiotics saved the lives, and you went from a 50% chance of dying if you got TB to a 0.03% or 0.3, less than around about 1 in 1,000 chance of dying today from tuberculosis because of medications. But they never really developed a very good vaccine. And so the great change of tuberculosis is the epidemiology, the public health issues of changing the nutrition, changing the water supply, changing the sewerage, and understanding distancing and all those sorts of common sense things about managing. Now, BCG was developed out of Pasteur's laboratory as a vaccine, but while it does have some impact in young children and preventing systemic disease of tuberculosis, it's never had a significant impact on adults. And so,
or on the person-to-person transmission.
The person-to-person transmission. And so the point I was making with tuberculosis is that it emphasises the value and importance of public health. And that's something, I think one of the things you can see with our COVID pandemic is we splintered these planks. We made obscene the idea of using effective medications. We made a vaccine, instead of being a valuable adjunct, we made it centre stage and said, look, it's going to be a year, but don't worry, it's coming. And we built the whole narrative around this idea that we have essentially nearly a single thing that was going to save us, which of course was all nonsense.
Yeah.
So that was the reason for the tuberculosis comments.
No, I think it's such a good point because, if you look at the decline in tuberculosis from, say, about 1870, 1880, it went down really dramatically. There was a couple of blips in the First World War, another blip at the Second World War, where it levelled off or even went up a little bit. But since then, it was going down really quite dramatically. And people often don't realise that streptomycin wasn't until 1952, I think, the first.
1944.
What was it? I mean, it was
it was the first. Yeah,
I think that was the first clinical trial.
First clinical study.
It was as early as that, 44, but it wasn't publicly available till.
And it was a single drug. Before they realised that it was effective, but people became resistant very quickly.
Right. Yeah.
It was only when they had PAS and isoniazid to make this triple therapy that became the recognition that you needed multiple therapy to treat it. And that, of course, has been refined over the years. We have just dual drug therapy, and instead of having it for 2 years, you can have it for 6 months. So, there's been huge changes in the way, but that doesn't change so much the incidence of tuberculosis. It is very good for the person who gets tuberculosis. Because instead of having a 50% chance of dying, you've got a 1 in 1,000 chance of dying.
But that's not what got rid of tuberculosis. It was going way down before that for all the simple public health.
I was looking at the diphtheria data.
Oh, yeah.
recently for another reason. And it's something very important that diphtheria vaccination was brought into the schools in Australia in the mid-1930s. And the incidence of diphtheria had halved in the decade before the vaccination began because of recognition of public health issues. And so the point is that these planks work together to form a floor. If you don't have one of the planks working, you've got a hole in the floor and you can fall through it.
But as you say, public health is the real main thing. It's how people live. And if we've got a few high-tech things to add on to that, much the better.
It helps to have good public health physicians, which sadly we don't have so many.
Indeed. I don't know quite what's happened to public health.
It used to be something that people would love to become, a public health physician. And my best friend out here was professor of public health. And, he pushed and promoted, but you still don't see the top people going into public health. They should. And I think
you get strange people being public health physicians now as well sometimes.
Let's hope with some changes that occurred yesterday in the United States, we may move back towards preventing medicine rather than running after it.
Yeah, I am coming on to that. But to just briefly evaluate the effectiveness of public health during the pandemic. How effective were the public health measures that were taken?
Well, that's a central question. We had in our plan to do exactly what we didn't do, but was done for us by Stanford University. Stanford University had some very, very smart people. And the leader of this group said, we've got this new pandemic, let's find, no one else seems to want to do this because we got this huge vaccine we're going to get in a year's time. Let's take, I think it was Santa Clara, which is an area of California, and they went out and looked at over 3,000 people in March of 2020. Now, this is very, very early, and they got an incredible surprise. By measuring antibodies, they could show that already 2 to 3% of the people had experienced infection. But interestingly, 40% of them had never had symptoms. So against the threats at the time of this terrible pandemic that was coming, and it was, I mean, I'm not underpinning or understating how nasty this was for a lot of people. But what they were able to do is say, look, the people who get nasty infections are all over the age of 70. I mean, I was looking at the mortality recently, comparing Sweden and Australia, and I found that something like 95% of the people who died in probably both countries were all over 75. And what came out of this incredibly important study was that what we need to do is recognise that COVID for most people is a nuisance, nasty nuisance of a disease.